Hello, is this thing on?
Do you think they can hear us?
Nah, let's say it again. Hi, and welcome to the Gritty Nurse Podcast, an unfiltered discussion related to health and healthcare. My name is Amy,
And my name is Sarah.
and we are your podcast hosts.
If you're listening on Apple Podcasts, Spotify, Google, iHeartRadio, Amazon, or any other podcast listening platform, don't forget to subscribe so you can get updates to when we have our latest episodes. Also, don't forget to rate and review us.
And if you like what you're hearing and you love our advocacy work, don't forget to go to www.grittynurse.com and click on the donate button.
As little as $1 or $2 a month for a total of $12 a year will help us with our monthly podcast costs, such as website hosting, our hosting platform,
audio equipment, and the time and energy it takes us to put out good quality episodes. We thank you and we appreciate you. Today we have a really great guest. And I think this is timely that, again, we're talking about burnout and mental health stress because, just yesterday I actually read a report where they were saying that over 41% of nurses are thinking of leaving the profession after the pandemic ends. And that is a very, very scary number. I can't even think in my own time of being a nurse in the last 10 years about leaving the profession. I've had a lot of stressful times, but the fact that there's an overwhelming amount of nurses, and I don't even think it's nurses, I'd love to hear from physicians and other people who might be working in this field. Um, People are wanting to leave. There's a lot of burnout, and I hope we're gonna talk about it today, and hopefully we can have some type of good, courageous type of conversation to say, hey, this is something that's happening and we need to pay attention to it. So, Sarah, please introduce our guest today.
Okay, so up on the podcast, we have Dr. Jason Harley. They are a tenure track assistant professor in the Department of Surgery, Faculty of Medicine, and Health Sciences at McGill, and a scientist at the Research Institute of the McGill University Health Center. The overarching goal of Dr. Harley's research program is to support the current and future well being of clinical performance of healthcare trainees through innovative educational interventions leveraging interactive simulations and emerging technologies. Dr. Harley's research includes over 50 peer-reviewed publications, 31 broadcasts, and 37 print interviews in venues such as The Guardian, CBC News, The Globe and Mail, Global News, CTV News, and Radio Canada. Welcome, Dr. Harley. It's an honor to have you here.
Thank you so much. It's a pleasure to be here talking with both of you.
You know, it's funny. I actually found you in the episode of W5 that we were both on. And when I was watching it, I thought, wow, this is like some really innovative research that you're coming out with. And it really hit home because a lot of what you were saying really resonated with me as a nurse and even just what I was hearing from my colleagues. So, in just bringing it back to your research, what do you think is unique to healthcare workers when it comes to things like anxiety, depression, and burnout?
That's a great question. I think one of the differences is about stakes. A lot of the time, one kind of emotion regulation or coping strategy that many of us will use we'll say something to ourselves like, oh well, at least no one's going to die. And this might not be the case, as kind of a nice heuristic to pull out of the bag. The stakes are higher in healthcare because patients' lives are often on the line, and certainly the well-being is. And because of this, we know from research in emotions and other related areas that this creates an environment for higher intensity emotions. And that means, too, that those emotions can be more challenging to regulate. So there's a lot going on. And certainly in the context of COVID-19, there were a lot of unique work-related stressors that were arising as a result of COVID. There were concerns about, especially with frontline healthcare workers, such as nurses, concerns over catching COVID, people's own health, the health of family members, the all kinds of changes with regards to protocols that were being made, that where hospitals and other healthcare locations were rapidly and creatively adapting to the pandemic. These were all things that had learning curves and challenges and were unique. So there's been a lot that our healthcare workers have been asked to and have been working with for this pandemic. So that's kind of a quick answer to both kind of the broad picture and a little bit of some of the specifics with regards to COVID.
I wonder again how common is all of this? Like, I mean, nursing burnout has been something that we have always been struggling with. I think the pandemic has kind of elevated how bad the stress is in terms of burnout and mental health stress. But, could you maybe share some of your stats from your research related to these areas?
So we found that again, and you're quite right. It's been documented in the literature for a while that burnout, stress, etc., has been a problem and a big one for the health professions for a while. One of the things we found that was more concerning with our study was that we found that there was a significant increase in the intensity with regards to stress, burnout, anxiety, depression, etc., for both physicians and nurses when we asked them about how they were feeling in terms of these indexes of psychological well-being in compared to how they were feeling at the moment. Now, this study, it should be mentioned too, was conducted around last summer, around I believe August, if I'm not mistaken, and just came out and was peer reviewed a couple of months ago. So somewhere between maybe 4 to 6 weeks ago or so. So with that said, we would expect both the prevalence and perhaps the severity, to be something that we really need to be mindful of at this time, including with it being, we're moving into things getting better. We have our traffic light system in Quebec, and we're in Montreal. We're going to be moving into orange next time, which will be nice. But our healthcare workers have been asked for quite a while now to be dealing with higher loads of stress, and so it'll be important not to just assume that that goes away with the changing of lights and our color systems.
Hmm.
Well, I wholeheartedly agree with that, and I think that's something that can't be lost on any professional during this pandemic or any politician or whoever can make the decisions related to, mental health seen as healthcare because I feel like what's starting to happen, and I hate to say this, that I don't know what it's like in Quebec, but it seems like the attention now is even less, right? So, like, we had the whole nurses are pandemic heroes, they're healthcare heroes. There's the banging of the pots and pans, all the symbolism. And, lots of nurses have been seen in the media now talking about, various things related to mental health stress, burnout, what they're seeing in the ICUs. But actually, we're not really seeing any mobilization of change, and I think that's the most disturbing for me, right? Like, myself and Sarah set out to really make sure that nursing voice has been heard. But I think what's really concerning is, through all of this, all of the stress, all of the things, the negative things that we're saying is going to come up after the pandemic. My fear is that there's no movement, right? There's nothing that's really tangibly going to change, and this is one of the things that worries me the most because it's like, we continue to talk about mental health, we continue to talk about these things, but I don't actually see any tangible solutions at this point from a government standpoint in terms of, better, like, are they going to increase mental health benefits? Like, I think one of the things we continue to say, like, I don't know maybe you can give us an example of what it's like in Quebec, but some employers only offer $200 for mental health support, from your extended benefits. One assessment is about 125 to $175. Like, I think it's really concerning that I don't see that needle moving. And what's your experience? Do you think that we're going to actually see some more mobilization in terms of change towards supporting mental health?
I think it'll be really important to support mental health for our healthcare workers. I mean, one of the results that we found within our sample was that, as I think I shared on W5, was that about half of our nurses and 20% of our physicians expressed, an intention to quit their job. So that's a lot of people. Now, that being said, our sample was around 120 or so, which is again a percentage of again the total number of people we'd be drawing on from our healthcare system. But nonetheless, of that sample, that's still a good chunk of people. Even if it was only those people, that would still be a lot of healthcare professionals that we would be losing. So I agree that it'll be really important to be looking for ways to support healthcare professionals. I think that there's been, what I've been seeing in on the hospital side specifically, and I readily acknowledge that what goes on in hospitals, there's, nurses are working in different types of settings, as are other healthcare professionals. So there's different things that are available. I've seen, there being the mobilization of different types of platforms for mental health, and there being a shift in terms of, more online, modules and information that's accessible for people, that's confidential, that people can log on to. Sometimes having a hub where things are organized can make things helpful. There's phone lines that are available, which is something as well. And I believe there's also consults and support services. But again, those things might vary by not necessarily, those are probably more like institution specific things where someone's working. So there's also, questions with regards to kind of, is there a minimum within a province of what someone can expect to have with regards to support? And certainly the other thing to consider as well is to make sure that when those supports are being designed, that they're going to be things that people are going to be comfortable and motivated to use. And I think one of the most interesting but also concerning findings that we found from our study was that not everyone was necessarily aware that the counseling services were available. But of the people that were aware, people were like, yes, this is something that's really important and valuable. But then, maybe like it was a very, very small minority of people who went and used it.
Right.
So this shows that just because something's there doesn't mean that it's necessarily, first of all, if it's there, it might not be meeting needs or might not be meeting perceived needs. But then even if it is there and meeting perceived needs, people still might not be reaching out to it. So one of the things that could be underlining this could be, stigma that's attached for reaching out and seeking help for, for mental health challenges. That's part of it. There are other possibilities as well. So this is where I think that it could be good for there to be, again, consultation going on with regards to what these different types of supports are, so they're not designed in a silo without feedback from really the people who are going to be using them.
That's really good insight, because that was actually going to be my next question. Is when I was looking at your study, it seemed like there was very high awareness of counseling services, but very low uptake. And I think stigma is part of it. But just going back to what Amy said, I think that the amount of benefits that were allotted, especially in my case particularly, I was allotted something like $500, which gave me 2 visits with the same counselor, luckily, but then it ended. And then you're forced to make that decision. Do you continue and pay out of pocket, or do you just end the visits that you've had with this person that you started to develop a relationship with? So I think there really needs to be some sort of better services for nurses, and not just nurses, for all healthcare professionals. I think this is definitely something that's lacking. But another thing I was thinking is just seeking counseling might be going into the unknown, because you really don't know what you're getting into. Whereas if you took advice or you talked to some of your friends and family, at least you kind of know what you're getting into, if that makes sense.
Mm-hmm.
And a lot of nurses are afraid of change. So that's another big thing to think about.
And definitely, a lot of people reported in this study that some of those resources, like being able to talk to family and friends, having supportive colleagues, these were things that really made a difference for people during the pandemic. So these are great things too. How we've conceptualized, things in the research group that I'm part of is thinking about both coping strategies, so things that people can do to to feel better, etc., but also sources of support, things they can, resources basically that people can reach out to. And certainly reaching out to, to use these sources of support can be a strategy, but they're a little bit different. And we found that conceptualizing them as kind of different things can be useful, because in the literature, seeking social support, that would be an adaptive coping strategy, but there's lots of ways and forms that can take. And some people, for example, might have access, to family and friends, but maybe they might feel less comfortable with colleagues, or vice versa. And so I think that this helps us to take stock of what kinds of of not only kind of the repertoire of things we might do to feel better, but also the resources, not only material but human as well, that we have around us that can help. And so that might be useful as well for people in thinking about this broadly. And then, going back to what you were talking about before with regards to, 2 sessions of support, it could also be maybe useful to see, maybe where that number comes from. Do nurses tend to find that this makes a difference to see 2 people on average? Those sorts of things, so that there's a little bit of context behind it, and this can help people make decisions and identify, next steps and areas for improvement potentially as well.
Right, and I mean, I was actually thinking that I think you're reading our minds because it's like, yeah, we need to talk a little bit more about the coping strategies and what resources that we might be able to utilize if we don't have, those various types of benefits that are afforded to us. But before I even kind of get back into the coping strategies, I kind of really want to touch on the stigma. That's, I think, one of the biggest reasons. Like you said, like 10% would be willing to use those services. That's such a low number, right? And I mean, I think there's so much work that needs to be done in terms of understanding mental health. And I think we saw another example of it this week with Naomi Osaka. And she's a famous tennis player, and essentially I guess she might be going through some form of a mental health crisis. And instead of, the tennis world showing her support, I guess not necessarily not the specific tennis world, but the people who set the matches, they ended up finding her and was like, well, if you don't want to speak to the media, we're gonna just fine you. It's like, wow, like she is saying that she needs some mental health support, she needs some downtime. And it's like this person's now being penalized for it. So I get it, right? I get the fear of, maybe coming out, and especially thinking about our professions where we as nurses are, and nurses, physicians, we're supposed to be seen as the people that, we have it all together, right? We are the ones taking care of you, so we can't fall apart. But I think again, that is a misnomer. And that stigma that comes with mental health, we feel that, we can't put ourselves in that position. But I know that there are a lot of people who are suffering out there. And what are some coping strategies that we might be able to give people, that if they're not ready to go out to see someone, what is there something that they could do in the meantime until they reach that point where they feel like reaching out?
That's a great question. I think I guess I'm sure we could talk for like hours. There's all these like things as you were
Yeah, yeah.
talking about, and I'm like, oh, I could touch back on that, and then I'm probably going to forget.
It's all good. It's all
But
good.
yeah, I would say one of the things that's, I think, helpful for people is to remember that, and it's always kind of fun to talk about coping in the sense that, and these are scientific terms and in some cases clinical terms, but they're also colloquial. So we'll kind of talk about them in all kinds of ways and have all kinds of different meanings attached to them. But at the high level, I think one of the things that's helpful is for us to remember that there's both adaptive and maladaptive coping strategies.
Right.
Yeah.
And so just because we're doing something about it, doesn't mean that it's an adaptive thing to be
Mm.
doing. So, for example, and there's also some things that can be, a bit of a Goldilocks phenomenon, if I've got my fables right, where in the right dose, it can be okay. So for example, denial doesn't really help. So kind of, sticking your head in the sand. Substance abuse isn't a great idea either to lean on.
Yeah.
Self blame isn't helpful. And one of the things I did want to, cycle back to quickly is that, so many of the people I know, or all of the people that I know, for at least my part, who are in the health professions, are there because they care about people,
Right.
because they want to help people. And when that's the case, and you're in a profession, that's high stakes, and sometimes, not all the outcomes are the outcomes that you're working for and that you're
Yeah.
working towards, and that can be really hard when you're in a career that's so vocational. It really sets itself up where, you're going to, it's understandable that there's emotional hits that come along with that. And so that's where I think, people have sometimes emotions about having emotions. And you were talking about a little bit about this before, like, oh, aren't I supposed to be, kind of a superhero? I'm a nurse, I'm here to help other
Right.
people. But that doesn't mean that you don't feel. You're not a
Hmm.
robot, We haven't met each other in person, but I'm pretty sure. um, so it's not fair to to feel shame or guilt, for example, for feeling sad or feeling upset when there's been a really unfortunate outcome. And so those sorts of self blame things, that's not helpful. We have to remember that we're human, and that we're going to have human reactions to tragedies and to unfortunate outcomes. And shifting towards the positive side of things, acceptance as opposed to self blame, is important. Accepting that we have emotions, and accepting that in some cases they can be easier to manage than others. Though that's normal, and that's also an important part of making a decision, to reach out for help. To acknowledge and to recognize that there could be challenges that someone's experiencing.
Mhm.
Positive reframing is another one that's really important. And this is where we're kind of exercising, our abilities to think differently about something. That doesn't mean, and that's very different from kind of, pushing it under the rug or, denying it. But instead, for example, we can we can feel powerless sometimes
Right.
when something doesn't work, when etc. When it's like super broad. It can be helpful to remind ourselves sometimes, of the things that we can do. So we might not be able to take the course of action that we really wish we could, but what are the options that are available on the table? It can be important also to remind ourselves. So this is kind of about shifting our attention. It's easy for us to get hung up, understandably, on the bad things, on the frustrating things, on the
Right.
scary things that happen during the day. And often the positive things, whether they're small or big, really tend to not always shine as bright. And this might have to do with some kind of evolutionary instincts where we're so attentive to threats and less attentive to rewards or to
Right.
positive
Mhm.
things, because something positive happens and it's like, yay, that felt good, move on.
That's true.
Kind of thing. But it could be good, and I would encourage people to try to remember those good things when they do happen, and to kind of keep them in a pocket of your brain or something like that. And so that when something that isn't so good that happens, that you can remind yourself of a positive patient interaction, of a great patient outcome, of the difference that you're making every day. And because it's so easy to get knocked down sometimes, by those negative things, that being able to balance the books, psychologically, by just shifting, our attention to some positive things is helpful. Same thing with kind of the time scale. We fall sometimes into rumination when we remain kind of fixed on something that we're not happy with, or sometimes we can become kind of paralyzed by focusing on an uncertain future. And it can also be important to try to remain, to acknowledge what's coming and what we do know and what we don't know, and to acknowledge what's just happened. But it's also important to focus too on what we can do in the present, not only to help others but also to help ourselves. And so those are some things that I think might be helpful, along with humor, tasteful humor. But
That is, like, so inspirational. I think that's a great overview of a lot of the things that I do personally just to, focus on the things within my control, stay positive. I was just wondering what you think about venting, because this is something that I feel like nurses do a lot, and I think it could be positive or negative depending on how the venting occurs. I just wondered if your research found anything about venting, or if you have any opinions on that.
Yeah, we vent a lot and we're very cynical too.
Yeah.
so venting would be, is typically seen as a maladaptive coping
Right, I thought
strategy.
so.
But I think
Mhm.
that
Okay.
you know there's a little bit of a Goldilocks thing though here too, I suspect, where there's a difference between, and I think where something becomes venting or rumination is when things stop being an opportunity to express your emotions and express challenges that you're experiencing with friends, with coworkers, with loved ones. I think that's healthy. That's also connected to, again, seeking social support, and that's what friends and family and close coworkers are, a role that they can play. but where things kind of slide off the cliff, so to speak, maybe not a cliff, maybe something a little bit less, less intense, would be where it falls into rumination,
Right.
where we're just kind of we're stuck in a spiral, and we're not we're not engaging in any of the perhaps adaptive things that we could be doing alongside the venting. And so that could be, it's important to express again how we're feeling and what those challenges were. And part of the reason that that's a good, healthy thing to do is that by talking it out and by talking with others about it, there's an opportunity. It's important for people to, to accept and to acknowledge those feelings. But it can also be helpful to have other points of view in terms of like, okay, like, so, what can we, is there something that we can do about that? Is there a way that we could look at this, depending really on what that challenge is? And so after we've kind of, gotten out, gotten it a little bit out of our system, had a chance to air, that frustration or anxiety or upsetness, it can then be good to kind of switch gears. And so it's when we get caught in kind of in a rumination cycle, and we totally can co-ruminate as well.
Right.
And
Mhm.
so we want to kind of avoid that spiral. So it can be good to maybe go around that. We think about it like a circle, maybe going around, once or maybe twice or whatever is good. We don't want to kind of just keep circling endlessly, because
Mhm.
that's just going to, increase that frustration or anxiety. And we're not going to, it's going to make it harder for us to shift from having an honest, frank conversation about something to moving into kind of, a planning mode or a problem focused approach to something.
See, that's really tricky though, Jason. Like just that rumination cycle, and I could tell you for nurses, I can't speak to any other profession, but like we are notorious for ruminating. I tell you,
Oh, we are the
if you could
worst.
have a bird's eye view into like a private Facebook group of nurses, you'd be like, you guys are some of the most negative people I have ever met. Because like I could tell you, even just this week, right? Like I'm trying to find silver linings. So even I'm starting to have a little bit of difficulty and feeling a little bit cooped up with everything that's happening with the pandemic, and wanting to have friends over, wanting to kind of get back to that sense of normalcy. We're seeing the numbers going down, but I could tell you, you hit a nursing blog and it is just like, this is all the stuff that's wrong. This is all the stuff that's bad. This is and then everybody, it's like that group think, right? Everybody now is chiming in. Everyone's saying how shitty it is, how bad it is. But it's really hard because that's your community, right? Your community
Mm-hmm.
is all ruminating about, and it's not that it's unwarranted, because really I think there has been an overhaul that had been needed in nursing, and there needed to be that rise of nursing voice. But now it's like, it's just everybody's just super super negative, and I get it, right? Like, so, like Sarah said, people have seen more death this year than they have ever seen in their entire years of practice, right? And I understand it's really difficult, but for a group that is, you know we almost thrive on this group think. How do we get out of that rumination cycle? Like, we are going to go back with those, same seven nurses that we might be on shift with, from yesterday. It's just, it's locker room talk, right? That's the stuff that we're all talking about, but it's like no one's really doing anything.
So that's a really good question. It's a really hard question. I would say that, on one level, one of the things, that that you can do, and I guess there's a difference too in terms of kind of like what the objective is. If the objective, for example, is just pausing that rumination, because rumination is going to arouse emotions like anxiety and frustration, and that can make things harder if we're kind of constantly in that. So complaining about something however warranted with a colleague, and then checking in on social media and it being more frustration, and then opening up the news and it's just kind of like negative, 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 negative.
Yep,
that
yep,
can
yep.
be that can be hard. And negative emotions deplete resources, typically. So it's also going to make it harder to help find solutions, or to chat about them. If you're just drained from being stuck, in that space all the time. So one of, I think, the simpler things to do, and I've certainly practiced this over the pandemic, especially with with friends and sometimes with colleagues, where we'll just take a pause, or I'll try to be a little mindful of how long we've been spending
Right.
talking about something, and then at some
Hmm.
point it's like let's just be mindful about like, yes, this is frustrating. It's frustrating for real reasons. We want to do something about this, but I don't know what that is right now. And I think we've explored kind of the problem from what we can do about it maybe at this moment. So let's like kind of put a pin or a pause on that, and let's just talk about Bridgerton or something that was just
Yes. Oh my God. Yes, please.
yeah, and let's like encourage season 2 to come along,
Yes, I
or
agree.
whatever. So stuff like that, and then you can come back to those issues more refreshed,
Right.
which is going to help a little bit, because otherwise it can just be really taxing, and even maybe harder to think about what one can do in terms of in planning is a really adaptive coping strategy, and that's something that can be helpful to do to kind of break things down. So tackling kind of a provincial issue might be is certainly really tricky, but breaking a goal down into steps, kind of are there things that I can do kind of for myself, such as again recognizing, for example, when maybe the talk has been negative again, for cause, etc. And can I put those pauses in for myself? What are maybe some things that I can do, or maybe even applying a strategy like that, with colleagues, and then kind of work your way up so that you're kind of making something that you can scale up or change, but kind of taking it one bite at a time,
Right.
um, might be something that's helpful as well.
Hmm. And I think it's worth acknowledging that when you do realize that you want to take action, that does take time and energy, right? So it does require a certain level of commitment, but also the constant rumination, the constant venting. I think that takes a lot of energy as well, and it turns into negative energy. And sometimes on a unit, when you have that one person, the negative energy just spreads to everyone else. So I think that's something to be mindful of as well, that when you're in a position of leadership or you're the more experienced nurse on the unit, people look up to you and they look to how you react to situations, and what you do kind of influences the rest of the team. So I think that's just something to keep in mind.
Absolutely, I love that you mentioned that too, because the reality is that we want to be mindful of how we're coping with things and do our best to do things that are going to make us feel better, and help us do a better be the best we can be on the job. But we also want to help our colleagues, help our friends, help patients, etc. And so when it comes to to emotion regulation or coping, there's also a lot of things, just like you said, that we do when it comes to other people. And so being attentive to the emotions that people are feeling, not just ourselves but others, because those emotions absolutely do spread. Um, One of the terms that we use in kind of the research world around emotion regulation is emotional contagion,
Oh
which sounds
God.
kind of
No,
like,
no.
yeah, paints like kind of a colorful picture. It can go both ways though, right? I
Right.
mean, laughter is infectious, and I guess maybe frowns are too, or something
Right.
is a little bit reverse of that. So those are things that can be helpful by paying attention to not only how we're feeling but to how others are feeling. We can be attentive, and we can totally, and finding ways of being respectful to point things out. So acknowledging how someone feels, and maybe suggesting that we pick up that thread a little bit later, or something. There's all kinds of ways to do that, but being aware of how we're working in groups is a great idea.
Jason, I think you've touched on so many really interesting and important points. Like, I think even the small, tangible steps that we can take to just say, whether it's taking a breath, or what is actually happening in the moment that's creating some of this anxiety and depression, or what are some small things that we could do in terms of, yes, we might be trying to tackle a big problem, but maybe there's some small little things that we can do along the way. I mean, all of this for I feel like myself, I've gotten some therapy tonight, honestly. So I'm really grateful for you. I'm thankful for you. Um, but is there anything else that you'd like to add to the conversation that we might have not touched on tonight?
I think maybe two quick things. One thing would be that our research found that adaptive coping strategies did make a difference for people. So they did help people, better deal with stress, and this kind of buffered people against things like burnout. So it does make a difference with regards to whether or not you're engaging in adaptive coping strategies versus maladaptive coping strategies, for example. But there's also something to be said, I think, with these things with regards to the frequency of use.
Right.
And a lot of things are about building good habits. And so it would be, I think, fantastic if we tried to remind ourselves, and that's something that I do as well, even though I'm kind of working in this area,
Right.
are to not just kind of do things once and to assume that by reminding myself once during a day of something positive, that's not going to buffer me for like the whole day. if
Right.
if it's a bad day and there's like bad things that keep happening,
Hmm.
I'm going to probably need to repeatedly remind myself of something good,
Right.
or of something I'm looking forward to. And that's the thing that we know from research on emotions, is that emotions are not they're not the same. A mood is this kind of like amorphous thing that's not necessarily tied to a specific event. But emotions are very moment to moment. They change rapidly. They're dynamic, and so just because we've done something to make ourselves feel better, um, you know 1 hour doesn't mean that there's not going to be something that could take us down, or on the other hand, make us feel great.
Right. Right.
The next. So that really it really relies on us to be attentive to our emotions, and to kind of then be ready, kind of remember what some of these tips and tricks that we've talked about are, so that we can try to deploy them. And I know that kind of sounds like it's a lot of work, and it kind of is, to be
I was gonna
honest.
say, it sounds like it's a lot of work, but I mean, I think it's worth it, right?
Exactly, and I think that's what what research has shown. And our study contributed to that. Um,
Right.
and I guess maybe the other thing that I'd just like to mention really briefly is that one of the things that we're working on, or just getting started and working on in my lab, is doing some work with regards to trainees, to try to give people experience really doing some of the things that we've been talking about tonight.
Right.
Um,
Wow.
you know, some explicit, practice, coping and regulating emotions during simulation training in particular. Because it's one thing to, to talk, to read about something, to read these, published studies and other people's published studies. And it's great to chat about things and hopefully bring concepts to life a little bit. But it's also really, I think, helpful to practice as well.
Yeah.
And it's especially helpful to have a chance to practice in a situation where again, there's not necessarily, there's no patient there in a simulation setting, so it's again a really safe environment, and it's a safe environment too to not succeed and to learn, etc. But because things are trying to emulate what it's going to be like on the clinical floor,
Mhm.
the emotions tend to be higher, and
Yes.
so you get experience, not just remembering what you would do like in a recall thing, but you get experience doing it, and
Right.
you get experience working through that stress and pressure, and then helping other people in your team do the same. And I'm hoping that this is going to be something that people find helpful in terms of moving forward. And it's, I think, one of many things, hopefully, that will, as a society and as a field, will be exploring, so that we're also not downloading responsibility for psychological well-being exclusively onto healthcare professionals.
Right.
And that's something that was important for me, that I didn't give the impression that it was just like, okay, everyone, well, just remember to positively reframe and
Right.
accept things. Like, everything will be good, and it's all on you. Go forth and be happy. There's things that we can do as individuals. There's things we can do to help other people. But I think that it's also important that that other groups, other sectors, try to contribute as well, and to equip healthcare professionals with the skills to support well-being. And in some cases, that I think I'm hopeful that this kind of new training program that we're getting going at McGill and the Steinberg Simulation Center is going to be hopefully something that makes a positive difference here.
Yeah, I think really I'm a big fan of simulation. I think it's the way of the future. I wish that in my training as a nurse I had been exposed to more of this, but it's really great that you're doing this, and we really appreciate all the research you've done and everything you've shared with us today on the podcast. I feel like I've gotten a lot out of it, and I think our listeners will as
Yeah,
well.
I agree.
I was just wondering, Jason, if you could mention where people can find you or how they can contact you.
Absolutely. I'm pretty easy to find online. My name's Jason and Harley, and I don't drive a motorcycle. People spell my last name and pronounce my last name wrong because I think I look and probably sound so incompatible with a motorcycle that I get all kinds of other things, Hurley and Harling. But it's not. It is the motorcycle, even if you can't picture me on one. And so if you Google me there, my institutional email is easy to find. I also have a Twitter account, which is, I think, Jason Harley 7. You can follow me there or share things. I'm not very active on social media, I'll admit. So email is great too. And I've got a lot of these resources, including some of the media, like television, radio, and print stuff, talks on this topic and other related ones. I have on my lab's website, which is the Sales Lab, which is SAILS, like a sailboat. I also don't have a sailboat. And I probably would be able to drive one or whatever. So that's also something that might be helpful. There's McGill's in there somewhere, so if you type like McGill, definitely hoping that people will find some of these resources helpful.
Yeah, we'll put everything down so people can get a hold of you, see some of the great work that you're doing, and connect with you if they need to. So thank you so much, Jason, for coming on the Gritty Nurse podcast, sharing your wealth of experience, and we can't wait to see what's next, what more great work that you'll do, and how you'll be able to help and change other people's lives.
Thank you so much for the invitation, Sarah and Amy. I really appreciate it. It was a lot of fun talking with both of you. And I loved your W5 spotlight as well. So that was a really fun way for us to connect.
Yes, absolutely.
Absolutely.